doing to talk about tech in healthcare. We really want to use this platform to kind of explore like what the latest technology is in healthcare, as well as like kind of probe for some insights with some of our guests to see what problems are we facing in healthcare today. So I'm Joshua, your host for today, and with me is Dr. Andrew. So Dr. Andrew is not just a practicing like medical doctor, he is also the founder and director of Autrui Global, which is a social enterprise which we'll get into more details in a bit. He's also a TEDx conference speaker, as well as he runs and operates a clinic in Subang Jaya. So #Subang Kia. And yeah, so so before we get started, I just want to say that for today, all your mics and videos will be on mute, and because it's a webinar. So for any question, but yeah, you can still ask questions in the chat. So feel free to just like throw them in there, and at the end of the session, we'll open it up and try and answer everyone. All right. Yeah. So thank you so much for doing this, Dr. Andrew. Like, welcome, and we really appreciate your time here.
It's a pleasure. Thank you for having me on today, Joshua, and good evening to everyone.
All right. So like, I think like the first thing I want to touch on, because we just mentioned about your social enterprise, like could you kind of like share with us what it does, what the cause is?
Yeah, so we are called Autrui Global. You might not have heard of the word Autrui, but Autrui means others. Why we call ourselves others? Autrui is a French word for others. We are very focused on serving the underserved communities because we really believe that health is something fundamental. It's a fundamental right to everyone, regardless of your socio-economic status, your background, wherever you come from. It should be a fundamental right. So our organization is very focused on providing accessible healthcare, affordable healthcare to underserved communities. Of course, we are open to the public as well. We serve everyone because we are a social enterprise. We run it as a business, but our social mission is to really provide healthcare to underserved communities.
So if I get it right, it's like that you're a business that operates like a clinic, but at the same time, the social enterprise side is for the underserved. You have sort of a special arrangement for them, where you heavily subsidize or you give them healthcare for free. Is it?
Yeah. So for underserved communities, let's give an example for refugees. We subsidize them when they come to our clinic. For children and expecting mothers, it's free for them because we believe that it's the best thing. The best investment is to invest in them earlier. So for children up to 2 years old, they get free vaccination. For mothers who are pregnant, we provide them with free antenatal care all throughout, because we know that if we invest in their early days, we give them a brighter future.
Yeah,
and of course, adults, we subsidize them for medications as well as consultation.
Yeah, that's a man, because like I know I'm spending a lot on my vaccinations for my kids' vaccination. So yeah, I'm sure like your work is very important to the community, and especially like when it comes to vaccination, because like it helps like it's not just that one individual. It's sort of like improving the herd immunization of the community, right? So great work. And you mentioned the French word altruism. Is that where altruism came from?
Yes, altruism is actually the root word for altruism. Yeah, which is to do good, right? Yeah. So that's what we're all about, essentially.
Got it. Okay, so let's talk about the problems in healthcare. I think like one of the the reason for tech is to solve problems, and like it's interesting to kind of like see from your perspective as a primary care doctor, right? What are the biggest problems in healthcare that you face on a basis?
Yeah, so of course, first and foremost, healthcare is an extremely complex system. you have primary care, you have secondary care, you have tertiary care. Tertiary care is like the hospitals where you go, we call it tertiary care, and secondary care is like when you visit more specialized doctors, like for example ENT specialists or surgeons in a particular field. So primary care is what usually the GPs do. That's like the first point of contact that patients would have before they maybe move down the healthcare system. But all these play an important role. It's complex. I think one of the biggest issue we have is because it's complex, things become a bit inefficient sometimes. Like let's say if you have a health problem, you might not know where to go to or which doctor to see, or you have to wait for a long time, like a 2 months appointment, or you get first opinion, second opinion, third opinion, like which is the right opinion in the first place, or you have a sickness in particular, you don't know where to begin. Should I go to a GP clinic, or should I go to a specialist, or should I go to the hospital straight away, or the emergency department? So because of that, things become very inefficient, not just for the patient, but for the doctors as well, because we don't communicate all that well, because it's not like we are meeting every day in this huge organization. So that is what I feel is really lacking in healthcare in terms of efficiency.
Because the way that things are structured is like everyone kind of fragmented, right? Where primary care have their own set of rules and their own way of operating, and then your tertiary care, your secondary care, and none of these like speak to each other.
Yes.
So it's the role. So the responsibility is in a way like on the patient to kind of figure out like what they need to do to get treatment. But like, how would you fix that problem?
So I think one of the things that tech has really helped is to bypass this whole complexity, because when you enter into the healthcare system, it's like a maze for you. Let's say, for example, we have the pandemic now. If you're COVID positive, what do you do? I mean, so many people have called our clinic to ask what to do next. Should I go to the hospital? Am I okay? Am I not okay? Sometimes even as doctors, we are confused. But with tech, we can sort of bypass things in a physical manner, meaning you don't have to go to a particular place to look for answers. Now you can just go online. There are telemedicine platforms that are available, and you ask a doctor or somebody that understands the system. So instead of going to A to B to C to D, you can go from A straight to D, just because you have access to someone who understands the system, and that someone can get you to what you need as fast as possible.
I see what you mean. It's like it's sort of like that space where you need you need to educate somebody how to navigate through this maze, and they can through a quick online consultation with you, or
So you actually need knowledge to understand the healthcare system first before you make a good choice on how you should decide on the next plan of treatment, or who I should consult to begin with.
I think we see a lot of people who will consult with the internet doctor, right? Like Dr. Google, right? About all their symptoms and whatnot. But when it comes to like how to actually go about it, like that's what's kind of missing.
Yes.
Okay. I think I think that is definitely a problem that is big enough to be solved by tech. But I think like I also wanted to touch on something where when it comes to solving problems in tech, right? Like in the past, like things have been very slow, like to adopt, especially in this industry. Because it's very heavily regulated. Do you think that's changed since COVID?
Yeah, I think it definitely has changed. In fact, it's like the pandemic is like steroids for the adoption of tech in healthcare. And because, let me give you an example. Let's talk about COVID again. Those who are in Malaysia know that, we have this COVID assessment center, meaning that, let's say, if you are COVID positive and you are in category 1, 2, or even 3, you would need to get yourself assessed at the center, right? But for the past a year and a half, you had to be assessed physically in the stadium or at the clinic or so on. But then we realized that, hey, we can actually assess some of the cases that are not so severe online, right? Rather than have people wait outside the hot sun, queue up for a few hours before they get assessed by a doctor. Now you can actually be assessed at the comfort of your home. So this has sort of forced us into thinking, hey, how can we make things more efficient? Can tech truly replace things that we do physically? And we found out that yes, we can. And yes, we can make things more efficient. And yes, there are groups of diseases and groups of patients that we can actually see online or assess online before we actually see them physically, or do we even need to see them physically in the first place? So yes, because we are kind of forced to a place where there is only one option. You either adopt it or you make people line up for hours and wait in the hot sun or to be assessed, or you adopt this approach. And by adopting it, we found out that it works. Yeah.
Yeah. It's kind of like it will be because it's the only option available, like that becomes the acceptable option.
Yeah.
Yeah, but before that is like it was very like healthcare is a space that you cannot move as quickly, like especially with tech. In the tech world, you have sayings like move fast and break things, or like fake it, make it. See, like you can't do that in healthcare industry because like it's people's life you're playing with. So it's always been heavily regulated, and like since COVID, like we've also seen that a lot more healthcare startups are appearing, which means that, people are out there trying to solve problems for this industry, and which means that there is more innovation that's happening in this space, lah.
Yeah, definitely. Yeah, and it makes our life a lot easier as well. I'll just give another example. When I was still training as a houseman, or we call it a residency, right, somewhere else. I remember we had one surgeon. He was a hand surgeon, and he was one of the few hand surgeons in Malaysia. So every time he's done a surgery post-op, he would need to kind of look at the hand to make sure that it's viable, it's surviving. But let's say if he's done 10 surgeries in 10 different hospitals, he has to visit 10 different hospitals to check the hand. But when I started my residency, we had WhatsApp, right? Or we had not just WhatsApp, but we could share information live, right? So now, from him having to visit every patient to check on the color of the hand or whether it's viable or not, he just could use the internet, and through the internet he could see how the hand color was, or whether the hand was actually moving, or whether it was still viable. He could really do so much more because of the introduction of technology, as opposed to last time. He had no day off. He had to work day and night, because there was no way that he can observe the progress of his surgery or post-surgery. Yeah, so this is just one example. It not just makes life easy for patients, but also for the clinicians sometimes.
Absolutely. I think we're also beginning to see more and more of that kind of technology like surface as well. Like I think I recently saw like a company that was doing handheld ultrasounds that connects to a tablet, so that
Yeah.
can be placed in some rural clinic somewhere where that live feed can be streamed to a doctor, specialist who may not otherwise be available in that rural area. It's bringing the care to places that wouldn't otherwise have it.
Yes, absolutely.
So speaking of which, right, like what sort of breakthroughs in technology are you most excited about for the future? Like,
I think ultimately, what is the goal of healthcare? The goal of healthcare is really to make everyone responsible for their own health, meaning to improve the health literacy of the public, right? That means with better health literacy, people know how to live a healthier life, to make healthier choices, and to have a healthier behavior every day. And with technology, we can definitely do that in the near future, or maybe even today. Like, for example, let me just give you an analogy. If we own a car, we would service it, right, every 6 months, or when the mileage is due, we will bring it to the service center, regardless of whether you're having problem with the car or not. Right, without fail, you will do that. You will not just bring to a service center when there's a problem or when you crash the car. But seldom do we do that for our own bodies, and we can't replace our bodies, right? A lot of times we just bring our bodies for like servicing when there is a problem, and sometimes it becomes too late already. I think one of the problem is that what are the parameters that will help us make the decision to bring us to a clinic? Or, how do I know I'm healthy if I don't do a blood test, or if I don't know my blood pressure? How do I actually know whether I'm healthy or not? Is it just a feeling? Sometimes it's not just a feeling. In fact, you can have high blood pressure but not feel anything. So I think with the introduction of technology, people can be more aware of certain parameters that indicate whether you're healthy or not. For example, just wearables that you have. It can tell you now things like your pulse rate. It can serve as an ECG, not the complex type of ECG, but to a certain degree, it can indicate to you whether it's a normal ECG or an abnormal ECG. You can even use it as an oximeter now, right? I'm not sure whether it's accurate, but I'm sure one day it will be accurate. So a lot of these parameters will be in the hands, not just of the clinicians, but it will be in the hands of the patients, that they know every day. I know my weight, I know my pulse rate, I know my blood pressure, I know my sugar levels. And when things are not correct, I need to see a doctor. Not when I don't feel good. I can look at numbers and I can make good decisions to know when to fix it. So I'm excited about that future, where the patient themselves can make good enough decision to fix a problem before it's too late, or to prevent something from happening. Because I believe that prevention is always better than cure. But to enable that a person to truly have that power to make decisions that are preventive, they need to also have certain information in their hands.
Yeah. I think it reminds me of like how tech companies are trying to measure every single metric, because they go by this saying like we can't if we can't measure it, we can't grow, because like you want to be conscious to every action that you've done, and what is the implication in terms of like the actual throughput, right? So you know to do more of something or do less of it. And so in the future, where wearables reach a point where it can give us like the kind of data that we can have for a blood test on a day-to-day basis, like we will be way more conscious to like our health, the things that we put into our bodies, and like our movement in a day.
So I think tech can enable that awareness that we would have, but it needs to be numbers. It needs to be data that the common person can understand. It doesn't have to be data that only a doctor can understand.
So is the goal of healthcare and tech in healthcare to ultimately make everyone live as long as possible?
Yeah, I think everyone should be given a choice to live life to the fullest, to live as long as possible, to live a happy life. Why not, right? Yeah, to live in a peaceful world, a healthy world. Yeah.
Yeah, and live on forever if possible.
Yeah, who knows? Who knows? Maybe time will tell if
Yeah,
technology
hopefully
can.
in our lifetime. Okay. So I'll just I think I would like to wrap up the session with a final question to you, and then we can probably like look in the comment section to take any Q&As, if any. Yeah, I was thinking of, like, we could close it off with this question where like, if you had one wish that you can wish for healthcare in Malaysia, like, what would that be?
If I had one wish, I think I talk about the 4 A's for healthcare. And if I had one wish, I wish healthcare would be more accessible for people. That means no more like driving, for hours in the jam to a place, but you can just access healthcare through, the internet like now. But of course, certain things still need to be done physically. We understand that. I wish it's affordable to everyone. It already is to citizens, but to everyone as well, like to underserved communities or to foreigners, to refugees, that it's available. There are some rural areas that healthcare is still not readily available to people. And lastly, it's that it's acceptable, meaning there's certain standard of quality of that is provided to everyone across the board. Yeah. So the 4 A's: accessibility, affordability, availability, and acceptability. So that's my wish for healthcare.
Nice. That's a very nice way to wrap it up. Okay. Let's see if there's. I don't see any questions, so I think we can end it here. Yeah. So thank you everyone for joining. Like, and thank you very much to Dr. Andrew as well, like, for sharing all these insights for, like, from your view. We really appreciate having you here.
Thank you. It's been a pleasure. And yep.
There's one thing I want to mention. If follow Dr. Andrew on Instagram.
Yeah.
Autrui just type in the Autrui Global.
Yeah.
Okay. Yeah, to Autrui Global.
Yeah. Okay. Thank you.
All right. Thanks everyone for joining. Thank you again, Dr. Andrew.
Bye bye.
Have a great day, everyone.
Have a nice evening. Bye bye.